Hello, I'm Laure, a rheumatologist from Paris, France, and it's a pleasure to discuss with you today our paper on the differences between women and men who have psoriatic arthritis. And specifically, our paper is entitled Women with Psoriatic Arthritis Experience Higher Disease Burden Than Men. So as you know, psoriatic arthritis is a chronic inflammatory disease, and it associates both skin disease, psoriasis, and joint and other structure disease, including peripheral arthritis, joint pain, joint stiffness, but also dactylitis and enthesitis. And all of these aspects have a considerable impact on the patient and his or her quality of life and ability to work. Now, we know that the sex of a patient may play a role in driving the mechanisms of psoriatic arthritis and also in driving differences in the clinical manifestations, but also the impact of patients who have a chronic disease such as psoriatic arthritis. So it appears that in psoriatic arthritis and spondyloarthritis overall, men are more affected by axial disease and women suffer more from peripheral polyarticular disease. So the objective of this research was to assess the differences in the clinical characteristics and in the impact, including on quality of life and work productivity of sex in psoriatic arthritis in a real-world practice. So we used data from the Adelphi PSA disease-specific program, and this was a survey of rheumatologists, dermatologists, and their patients with psoriatic arthritis. This is a large non-interventional cross-sectional survey that collected data about both disease management, treatment history, clinical features and manifestations, and outcome measures. And both patients and physicians filled in some data for this survey. So we collected these data in 2018, both in European countries, France, Germany, Italy, Spain, the UK, and in the United States. So patients had a physician-confirmed diagnosis of psoriatic arthritis. Of course, they provided their informed consent, and we performed some statistics to compare men and women. So what we're going to report are some of the patient quality of life measures, and these include the Euro-Qual-5D, which assesses general quality of life and assesses mobility, usual activities, pain, discomfort, as well as anxiety and depression, and the score goes 0 to 1. The HAQ, as you know, is a questionnaire for function, and it goes from 0 to 3. The WPI, or work productivity and activity impairment, assesses a percentage of overall work impairment. And the PSA-12 is a questionnaire for impact in psoriatic arthritis. So as we can see, women had a statistically significant lower score for the EQ-5D than men. As regards the HAQ, we found that women reported an overall higher functional disability of 0.56, whereas men were at 0.41, suggesting women have more difficulties completing their daily activities. When we look now at the WPI, we can see that the work impairment was quite in a close range, though a bit higher for women, with 27.9% compared to men 24.6%. And for the PSA-12, where higher scores indicate worse conditions, we can see that women were much higher than men at 2.66 compared to 2.27. Finally, the Charleston Comorbidity Index is a simple way to estimate the risk of death from comorbidities, and the higher the score, the higher the risk. And we can see that here, men have a higher score compared to women, though the difference is not huge. When we look now at joint counts, we can see that women report a lower number of affected joints at 3.2 tender joints and 4.1 swollen joints compared to 3.5 and 4.5 for men. And we can see from the graph that men's joint counts favor extreme categories with a higher proportion of male patients with less than 1 joint or more than 10 joints compared to women. We would need to go further on this aspect. So we can conclude that although the levels of physician-assessed disease activity were quite similar and the treatment regimens were quite similar, women reported a reduced quality of life and greater levels of disability and work impairment than men, although they had a lower comorbidity burden. We feel that further research is needed to explore this additional burden experienced by women with PSA and see also if this would warrant changing the treatments. Thank you very much for listening to this video abstract.